Have you ever wondered about Dubai versus USA? The truth about healthcare costs and what secret advantage they see that others don't. Most people think Dubai's healthcare is just for the ultra-wealthy, but the truth is far more surprising. And it could completely change how you think about medical expenses and insurance. Today we're counting down the 10 most shocking differences between Dubai and USA healthcare costs. And wait until you hear number 1. It will absolutely blow your mind. Before we dive in, hit that subscribe button so you don't miss more eye-opening comparisons that could save you thousands on healthcare. 10. The insurance mandate surprise. Did you know that Dubai requires health insurance for everyone, but it actually costs less than the American system? In Dubai, employers must provide health insurance to all employees, and the government mandates coverage for dependents too. A family of 4 typically pays between $2,000 to $4,000 annually for comprehensive coverage. Meanwhile, the average American family pays over $22,000 per year for health insurance premiums alone. That's a difference of nearly $18,000 per year. Dubai's regulated insurance market prevents the price inflation we see in the US, where insurance companies, hospitals, and pharmaceutical companies drive costs through the roof. This regulated approach means Dubai residents know exactly what they're paying up front, with no surprise bills or hidden deductibles that bankrupt families. But if you think mandatory insurance is interesting, wait until you hear about the actual hospital bills at number 9. 9. Hospital bills without the shock factor. What if I told you that a major surgery in Dubai could cost 60 to 70% less than the exact same procedure in the USA? Take a common procedure like a knee replacement. In the United States, this surgery averages $35,000 to $50,000. In Dubai's top-tier hospitals like American Hospital Dubai or Mediclinic, the same surgery with world-class surgeons costs between $10,000 and $15,000. Even emergency procedures follow this pattern. An appendectomy in the US can run $15,000 to $30,000. In Dubai, between $3,000 and $7,000 at excellent facilities. That's not a typo. We're talking about savings of $20,000 or more. These aren't back-alley clinics. Dubai's hospitals are internationally accredited, often by the same bodies that certify American hospitals. You're getting the same quality for a fraction of the price. But medical procedures are just the beginning. At number 8, we'll explore something even more expensive in America. 8. Prescription drug prices that make sense. Why does the same medication cost 10 times more in America than in Dubai? A diabetic American paying for insulin can spend $300 to $500 per vial without insurance. In Dubai, that same insulin costs $30 to $80. Someone with chronic conditions taking multiple medications could be saving thousands every single month. The UAE regulates pharmaceutical pricing, while the US allows pharmaceutical companies to set their own prices. A study found that Americans pay 2.5 times more for prescription drugs than people in other developed countries, and Dubai falls well below even those averages. For people with chronic conditions like diabetes, heart disease, or autoimmune disorders, these savings aren't just convenient, they're life-changing. Many Americans skip doses or don't fill prescriptions because of cost. That doesn't happen in Dubai's system. Prescription savings are massive, but number 7 reveals something about childbirth that will shock every parent. 7. Having a baby won't bankrupt you. Guess how much it costs to have a baby in Dubai versus the United States? In America, the average cost of childbirth with insurance is still $4,500 out of pocket. Without insurance, you're looking at $10,000 to $30,000. In Dubai, a normal delivery at a private hospital costs between $3,000 and $6,000 total, and a C-section runs $5,000 to $8,000. Even better, most employers in Dubai provide maternity coverage that covers 80 to 100% of childbirth costs. American insurance plans often have high deductibles that need to be met first, meaning families pay full price until they hit $5,000 or more in annual medical expenses. Starting a family should mean starting with debt. Dubai's healthcare system recognizes that prenatal care and childbirth are essential services, not luxury procedures. But what about when things get really serious? Number 6 explores cancer treatment costs that reveal a stunning gap. 2. Specialist access without the wait or the cost. Need to see a cardiologist or an oncologist? In America, you'll wait weeks and pay hundreds. What if there was a better way? In the US, seeing a specialist requires referrals, insurance approval, and waiting periods that can stretch from weeks to months. Then you face specialist copays of $50 to $200 per visit. In Dubai, you can book a specialist appointment within days, and the cost ranges from $80 to $200 for a consultation. Dubai has attracted world-class specialists from Europe, America, and Asia by offering modern facilities and competitive compensation. The result is that Dubai residents have access to internationally trained specialists without the bureaucratic nightmare of the American insurance system. When you have a serious health concern, time matters. Every day waiting for an appointment is a day your condition could worsen. Dubai's system prioritizes access to care, not insurance company profits. We've covered everything from routine care to specialist treatment. But number 1 is the most important difference of all, and it explains why Dubai's entire approach to healthcare is fundamentally different from America's. 1. Healthcare is treated as a public good, not a profit center. Here's the truth that changes everything. Dubai sees healthy citizens as good for business, while America sees sick patients as good for business. The UAE government heavily subsidizes healthcare infrastructure, regulates prices, and mandates insurance coverage because healthy residents are productive residents. In America, healthcare is a $4.3 trillion industry where hospitals, insurance companies, and pharmaceutical corporations maximize profits. When someone gets sick in America, dozens of companies make money. In Dubai, the goal is to keep people healthy and keep costs reasonable. Americans spend $12,914 per person annually on healthcare, the highest in the world. UAE residents spend approximately $2,500 per person for comparable or better outcomes. Life expectancy in the UAE is 78 years. In the US, it's 76 years. We're spending 5 times more and living shorter lives. This isn't about socialism versus capitalism. Dubai is one of the most business-friendly places on earth. But they understand that a functioning society needs affordable healthcare. The American system prioritizes profit over people, and the result is financial devastation for ordinary families while insurance and pharmaceutical executives make billions. Conclusion. So now you understand the truth about Dubai versus USA healthcare costs. It's not just about a few dollars here and there, but about a fundamentally different approach to medicine, insurance, and what healthcare should cost. We began by asking about Dubai versus USA, the truth about healthcare costs, and the countdown revealed it's about regulation, accessibility, prevention, and whether healthcare is treated as a right or as a profit opportunity. Do you think America could adopt Dubai's approach to healthcare regulation and pricing, or is the insurance and pharmaceutical lobby too powerful to ever allow real reform? Share your thoughts below. I read every comment. If you found this comparison eye-opening, smash that subscribe button and turn on notifications so you never miss our next deep dive into global healthcare, finance, and quality of life comparisons before everyone else is talking about them.